The type 1 diabetic patients respond to exogenous insulin, which means that insulin will bind to the insulin receptors on the adipose tissues and muscles and cause them to use the blood glucose. So let's see that what happens when the patient is on insulin therapy and faces the stress condition. So that stress condition goes in the favor of increased glucose in blood, and that is due to the increase of the glucagon level in the blood, and which leads to increase the blood glucose. It performs the same actions, like it causes the ketoacidosis that leads to nausea, vomiting, mental status changes, and cerebral edema. So as there is it causes increase in blood glucose levels, so it produces an increased volume of urine in the urine and causes dehydration. In order to overcome that, there's increased thrust. So all the same effects produced by the glucagon. The only sweet thing about the diabetic patients having type 1 diabetes mellitus is that there is some fruity smell in the breath of those patients because of the production of ketoacidosis. So let's see some of the lab tests for diagnosing the diabetic ketoacidosis. Number 1 is a blood urea nitrogen evaluation, then arterial blood gas measurements, serum electrolyte levels, bicarbonates level, urine dipstick method, complete blood count, electrocardiogram. That is very important because of the anine gap, or due to the hyperkalemia there may be some kind of fluctuations. Then urine and blood cultures to inspect infection, because the diabetic ketoacidosis is not only in the diabetic patient, it may also due to some infections. Serum glucose levels, MRI and CT scan to detect the cerebral edema and mental status respectively. So what are the treatment goals for type 1 diabetic patients? The treatment goals in type 1 diabetic patients is number 1, fluid resuscitation, which is basically due to the excessive loss of fluids from the body of the diabetic patient through kidneys. Number 2 is a reversal of acidosis and ketosis, then to insulin to get the plasma glucose back to the normal, and then replenishment of the electrolytes and volume losses. So these all treatment goals should consider first, because this is really very important to maintain the fluid inside the body and to balance the electrolyte level along with the glucose levels. So here is the diabetes mellitus type 2, in which the pancreas of the patient, or the beta cells of the pancreas, produces the insulin, but the tissues of the body fail to respond to that insulin, and that is known as the insulin resistance, shown by the different body cells. Actually, there are a lot of reasons for this insulin resistance, like the major one is obesity, hypertension, lack of exercise, inflammations due to the release of adipokines and free fatty acids. So adipokines actually releases by the fats that are deposits over the tissue like muscles or adipose tissue. So that adipokines and free fatty acids released from the fats causes the inflammations. That seems to cause the insulin resistance some way. Some patients may obese, but they are not diabetic, so some kind of genetic factors may involve in that case. So let's see see the condition of pancreas in type 2 diabetes mellitus. As we know that in type 2 there is an insulin in our blood, but the tissues are not responding to that. So in that case, the false positive feedback hits the brain to secrete more and more insulin from the pancreas, and this leads to the pancreatic cell hypertrophy, which means increase in the size of the cells because of the more load, and there is a hyperplasia, which means the cell of the pancreas releasing the insulin start dividing and they increase in number. So the diabetic type 2 patients have a kind of a hypertrophic pancreas and hyperplastic pancreas. Due to the production of more insulin from the beta cells of the pancreas over and over again, a time reaches when the beta cells of the pancreas get exhausted of producing too much insulin, and thus the cells of the pancreas start dying, which is the hypertrophy occurs. In diabetes mellitus type 2, there is some insulin is always present in the blood that prevents from ketoacidosis. So let's see that how the cerebral edema occurs. Like we know that glucose is the polar molecule, so when it is present in the blood, it will tend to drive more water out of the cells, leaving the cells shrinked and dry. So when this similar happens in the brain cells, some idiogenic osmoles generate within the brain cells that again draw the water in the cerebrum. That leads to cerebral edema. Third type of diabetes is the gestational diabetes that occurs in third trimester. In pregnant women, different type of hormones are producing. So that hormones performing their own functions also don't let the insulin to bind to insulin receptors, and in this way they causes the diabetes. There is always increase in the glucose level in that case. But sometimes those hormones also affect the beta cells of the pancreas. That means there will be no insulin, or less effective insulin will be produced from the beta cells, and in this way the gestational diabetes occurs. So there are some medications that causes the glucose level to raise in a body as a side effect as well. That is a medication induced diabetes, like statins, beta blockers, drug use in transplantations, and many more. So these medicines produces a diabetes as a side effect, which can be treated when these medicines are when the person stop using these medicines. The diabetes can also be vanished away. So let's take a view on the treatments for the diabetes mellitus. In type 1 diabetes mellitus, the insulin is the only treatment. In type 2 diabetes mellitus, firstly, patients should modify the lifestyle, like exercise, weight loss, healthy diet. Oral hypoglycemic agent should be the first option, but if do not work, then go for insulin on the second option. But there are also some advanced medication available in the market now that lowers the blood glucose level, like GLP-1 receptor agonists, which are the glucagon-like protein 1 receptor agonists, which have been recently approved by the FDA. Some of the risk factors are also associated with the insulin. So the patients who are receiving insulin may face weakness, hunger, shaking, fainting, seizures. So they should have a candy all the time with them, so that whenever they feel any kind of such hypoglycemic symptoms, they can easily overcome that. Along with that, they should not drive right after injecting the insulin, because that may lead to fainting, because as the insulin lowers the blood glucose level very fast. So sometimes these hypoglycemic symptoms are so severe and worse that can only be overcome by administering the IV glucose immediately. Hyaline atherosclerosis is a major damage that is caused by a diabetic mellitus. In this, the diabetic patients, there is a deposition of hyaline protein in the blood vessels that make these blood vessels hard, inflexible, thick, and also harden for the oxygen to diffuse through these and leading to hypoxia. So that all causes the medium or large atherosclerosis, leading to heart attack and stroke. The second major damage caused by the diabetes is the diabetic retinopathy. That is the effect of increased glucose level in the blood on eyes, where the patient have cotton wool spots that may leads to blindness. They may have some flare hemorrhages. All these signs can easily be diagnosed through fundoscopy. The third damage that is caused by diabetes is the kidneys. The kidneys of the diabetic patients are affected a lot because they are causing the excessive filtration of the glucose, and that leads to the overload on the kidneys, and the patient may depend on dialysis at one stage in their life. So the other fourth major damage caused by the diabetes is on the nerves, patient nerves. The sensation in the toes and fingers decreases, and that is the cause of stocking glove distribution. Poor blood supply to the towards the lower extremities, and the nerve damage in the lower extremities lead to ulcer that can't get healed. So it always take time to heal because of the poor blood supply to that area. So if that ulcer gets worsened, that may lead to amputation. So this was all about the diabetes mellitus. I hope that you find this video helpful. If you have any suggestions, then go ahead and write it below in comment section. Most probably my next video will give information about pharmacological receptors.